Imaginin mo, board exam bukas at hindi mo pa alam ito. Let's study with me. Our topic for today is cardiac tamponade. Now, we have talked about this one in our research classes, but what does cardiac tamponade really mean, sir? Like, malik na natin ang cardiac tamponade, di pa dyan na ako na mag-gets. Kakuya, okay, bahala mo. Char lang, let me explain to you in layman's terms. Okay, so let's go here. So cardiac tamponade means there is rapid fluid buildup in your pericardial sac. Now, what does happen if there is too much fluid accumulation in the pericardial sac, guys? So this happens, it leads to, guys, what? Tabay ko ninyo. Severe compressions. Okay, continue. Okay, continue tayo, guys. Medyo nawala ta sa focus, ha? Paparating ng board exam, let's prepare better. Wow! Confident pa siya makaingon. Our topic for today is cardiac tamponade. Now, we have talked about this one in our med-surg classes. But what does that literally mean? Uy, na sir. Uy, balik lang dito na dito ko kagaya ng cardiac tamponade ba? Okay, let me explain simple terms, ha? So, cardiac tamponade means that there is rapid fluid buildup in the pericardial sac. Now, when there is too much fluid accumulation like blood in the pericardial sac, what will happen? It will lead to severe compressions of heart, preventing proper filling, reducing cardiac output. So for example, if there is too much fluid in the pericardial sac of the heart, this can lead to heart not being able to pump blood effectively, causing reducing output. There's not enough fluid that is entering the chamber of the heart. So what will happen here is that it will lead to compression. So meaning the heart cannot move better than it did before because it is compressed by the fluid. Now, this is caused by what? Cancer, like what? Heart cancer, although rare, but it could happen. Also, it could lead to where cancer reach the heart, like metastasis from lung cancer, it reaches the heart. It could lead to this one. Also, infections, infections of the heart, if there is trauma, if there is aortic dissection, invasive cardiac procedures like cath lab, those like cardiac catheterization, like those. Also TB and kidney failure and hypothyroidism. Now, what are the signs and symptoms? What are the signs and system? What are the signs and symptoms po, sir? So here, there is sharp pain that the patient will feel. There's also heart palpitations. Why? I want to ask you guys why. Why is there heart palpitations in patients that has cardiac tamponade? If you have listened to your classes, you can answer this one. Guys, wala gyud mag-answer. That just means that the heart is working harder than it did before because it is observing that there is not enough blood being distributed to the organs of the body. There is decreased cardiac output, therefore the heart tends to work harder than it should be on a normal setting. So of course, that's why. The patient could also look like pale, gray, and bluish. Now, next, we have what we call here Beck's triad. And then there is, in Beck's triad, there is hypotension, meaning because there is not enough blood circulating, because the heart is not able to pump blood effectively. There is also bulging neck veins because of the inability of the heart to pump blood. So of course, the fluid will back up to where it has been before. Next is a muffled heart sound. Why is that? Why is there a muffled heart sound in cardiac tamponade? Guys, simply because there is too much fluid accumulating in your heart and it's also away from the thorax. Of course, you're gonna hear distant muffled sounds. You're not gonna hear that one sharply and clearly. It's because the heart is covered in lots of fluid. Therefore, the heart cannot make that sound as crispy as it did before because it is being surrounded by lots of fluid. Okay, so that's the Beck's triad. But take note that most patients only has 10 to 40% of this triad here. So hindi lahat magkagaganito. At least 10% to 40% of patients. Now, risk factors for having cardiac tamponade, patients with congestive heart failure, they are at risk factor for this one. Patients at our heart surgery. And then of course, what is ESKD? It is a end-stage kidney disease. Okay, now what is our diagnostic test here? So of course, healthcare professionals will do a physical examination. They will check the bulge of neck veins, they will check if there is hypotension, and of course, the most famous one, pulsus paradoxus, when there is decrease of blood pressure more than 10 millimeters mercury during inhalation. So you will also have a diagnostic test of echocardiogram, to which there's an ultrasound to show a real-time images of the heart size, how the chambers receive blood, ganon. And of course, your EKG. And of course, to check X-ray for what? Students, what? If there is too much fluid in the heart, what will happen? What will show in X-ray, guys? Of course, cardiomegaly. There is cardiomegaly that will show on the X-ray, huh? So next, of course, we could also do a CT scan for this one. Now, what are the treatments for cardiac tamponade, students? Of course, what we have to do is, of course, pericardiocentesis. What is that, sir? Hihigupin yung fluid na nandun sa pericardial sac by the means of straw. Char lang. It will be, kumbaga, synthesis, guys. Guys, third year pa kayo na hindi pa alam yung synthesis. Paulit-ulit na lang tayo niyan. A healthcare professional will suction out the fluid in the lungs by the means of in the thoracic. So, we will go ahead and kumbaga kunin yung fluid there to decrease the fluid accumulation there. So that's pericardiocentesis. Of course, dobutamine to increase heart contractility, to further deliver blood effectively to the systems and avoid hypotension. Of course, vasopressors. So this is the cardiac tamponade explained in simple terms. And of course, still as students, I could lay some misleading information here. So it's also important to study on your own, research and correlate them to what you have seen in your research. So thank you so much for watching, and I hope you have a good one.